So I'm going to be talking about seizure, convulsion. I'm not going to be going into details. I'm just going to be saying the things that we should do when someone is having a seizure. There is some contractions or uncontrollable jerking movements when the brain loses control of the body, basically. And usually it lasts for a few minutes and it stops. The person recovers. Some people have this seizure for a longer period. Some people have it for a short time. Some people have it regularly. They are known to have these seizures, and that's what they term as epilepsy. How will you know someone is having a seizure? Some people have a feeling before they have the seizure, before they convulse. Some people, it might just be because they've not had something to eat, or because their blood sugar is low. Some people could have seizure following head injuries. For children, it's very common with fever. When the temperature is really high, they can have seizures. And seizure is very, very common. But the most important thing to do when someone is having a seizure, someone is convulsing, now, make sure the environment is safe for this person. If the person is on a high place that he could fall down from, try to get the person out of that position. It's safe to put the person on the floor or the soft cushion, and remove everything around that can cause injury, like knives, sharp objects, glass. Just try to keep the victim safe. And if you've got pillows, cushions, you can put around the neck, and you can just allow the seizure to abort by itself, or to stop by itself. If the victim continues to seize for more than 5 minutes, then that is a bit more severe. So we need to actually take note of the time, how long the seizure is lasting, because it is very important for the doctors looking after the patient later to know. And like I said, the first thing, keep the victim safe. If there is anything coming out of the mouth like foam and stuff, turn the victim on the left lateral position, recovery position, so that they don't aspirate it into their lungs, that it doesn't go into their lungs. And try to support the victim. You can get a pillow below the neck. And avoid doing things like putting spoon into the mouth, because you can induce vomiting by doing that. You can injure the teeth, and it can cause more injuries to the victim. If it doesn't resolve, then you need to call for support and take the victim to the hospital immediately. If you've got ambulance support, you could call. If you've not got ambulance support, you could call for help, and so you can get the victim to the hospital safely. Like I always say, make sure you protect the victim from further injuries, and keep the victim safe during the transfer. And when you get to the hospital, make sure you give details of the type of seizure, because there are different types of seizures. Whether the victim, how long did the victim lose consciousness? Following the seizure, did the victim fall into sleep? Was there urinating or passing stool following the convulsion? And you need to keep record of the timing, how long the seizure lasted, and or how many seizures it was. So the most important thing to do when someone is having a seizure is make sure the environment is safe for the victim. Remove everything that could harm them, glass, knives, sharp objects. Try to keep them on their side if they are foaming from the mouth, or sometimes they could bite their tongue. Just keep them on the left side. Don't worry too much about it. the dangers when you try to do stuff like sticking spoon into the mouth and stuff. They could start to vomit, and the stuffs can get into the lungs and cause more infections and more damage. So when they get to the hospital, they will be more safer, they will be evaluated. If it's someone you know that is diabetic, you could check the blood sugar. If the blood sugar is very low, that could be the cause of the seizure. You could give some sugary drinks once the victim is awake and able to swallow. If not, there are a lot of gel that are available, glucogel, that you can put in the mouth. They're usually, easily absorbed from the mouth, and they could help a lot. And for children, the commonest cause of seizure in children is fever. So if the temperature is very, very high, you might want to expose them. You might want to clean their body with cool towels, wet towels, just to try and bring the temperature down a little bit. If they become conscious, you can give them some paracetamol while you take them to the hospital for further evaluation. I hope this is helpful. And seizures are not infectious, so if you see someone convulsing, you don't have to run away because it's not infectious. There's a lot of myth about saying if you touch the person you might get seizures or epilepsy, or if the foam touches you and stuff. So these are just myths. It's not communicable, so we should try to help keep the victim safe.